The Lancet launched its Obesity Series at a press conference in London, UK, to mark 4 decades of the rising obesity epidemic. If historic trends continue to rise, there will be 65 million more obese adults in the USA and 11 million more in the UK by 2030.
We looked at the national surveys in the UK and the US. The two surveys are called the Health Surveys of England and the National Health and Nutrition Examination Survey in the United States. These two surveys are population-based and nationally representative. We looked at the prevalence of obesity in the latest data point, that's 2007 and 2008. 26% of the UK adult population is obese. And in the States, it's more like 1 in 3 adults. For example, in the UK, if historic trends were to continue unabated, we projected that by 2030, there will be an additional £2 billion spent on obesity-related diseases. And that is substantial, roughly 2% of the overall healthcare spending in the UK annually.
A more realistic and accurate weight loss predictive model is introduced in the series.
We've created a web-based simulation model that predicts how body weight and body fat percentages will change for given changes of diet and exercise. And it's to be used as a tool for physicians and researchers to try to understand how much weight loss would be expected for a given change of diet and exercise in different kinds of people. One of the things that's kind of pervasive in the health and nutrition literature, as well as our own organization like the NIH and the NHS and American Dietetics Association, is that they've recommended people use a certain weight loss rule of thumb, which is the so-called 3,500 calories per pound rule. That sort of translates to if you cut 500 calories per day out of your diet, you should expect about a pound of weight loss per week. And what we realized is that that old rule of thumb neglects the changes of metabolism that occur as people cut calories from their diet. And so we built a mathematical model of how much the calories that are being burnt goes down when people go on diets and exercise programs over time as they lose weight. And we're then able to better simulate and make better predictions about the weight loss.
Dr. Stephen Gortmaker from Harvard School of Public Health believes governments must lead in tackling the obesity epidemic.
Well, obesity is increasing in countries throughout the world, and no country really has taken this on seriously and really made serious efforts to turn it around. In our paper, we review 21 different interventions for the relative cost effectiveness. And we found that some of the fiscal and policy interventions that apply to populations are actually cost savings. An example would be a tax on unhealthy foods and beverages that, if implemented, would reduce BMI, reduce obesity, reduce healthcare costs, and actually bring in a good deal of dollars to the state. It's a cost-saving type of intervention, and those are the ones we typically like to look for. I point to the example of tobacco, where early on it became clear that if you did not allow advertising of tobacco on television, you taxed tobacco, and then started to restrict tobacco in public settings, you could really reduce use and change the social norms of use. These are highly effective and cost-effective interventions, and I think the same thing will happen to certain types of foods and beverages that are just unhealthy. A good example being sugar-sweetened beverages, which are nothing more than sugar and water.